Do you sometimes get confused when your doctor says your white blood cells look strange in a blood test? Or maybe you've had frequent infections, but no clear reason why. While most people worry about heart pain or fatigue, a rare condition called Pelger-Huet anomaly quietly changes how your white blood cells look, not how they work at first. Think of your white blood cells like security guards in your body. Normally, they have multi-lobed nuclei like a brain with sections, so they can move fast and fight germs. But in Pelger-Huet anomaly, these nuclei look more like glasses or donuts, simpler and rounder. The cool part, most people feel totally fine. It's often found by accident during routine blood work. Sounds surprising, right? So what causes these odd-looking white blood cells? It's mostly in your genes, passed down from parent to child, like eye color or height. Imagine a spelling mistake in a gene called LBR, lamin B receptor. This gene helps shape the nucleus of white blood cells. When it's faulty, the nucleus doesn't fold into sections properly. Think of it like a misshapen balloon, because the mold wasn't right. It's usually inherited in an autosomal dominant pattern, meaning if one parent has it, there's a 50% chance you get it too. But sometimes, a person can have a similar condition without inheriting it. That's called acquired Pelger-Huet, which can happen in people with blood cancers like leukemia. So, same appearance but different cause, like two different stories leading to the same foe. Here's the twist. Most people with Pelger-Huet anomaly don't feel sick at all. No fever, no pain, no weakness. That's because, even though the white blood cells look weird, they usually still do their job fighting infections. So you could be totally healthy and not even know you have it. But in rare cases, especially in children with two faulty genes, homozygous, they might get more infections, have slower growth, or show skeletal issues like unusually curved fingers. Imagine being a kid with frequent colds that don't go away fast. Doctors might run tests and find these odd cells. But again, for 99% of people, it's a silent finding with zero symptoms. So ask yourself, have you ever had normal health but strange lab results? That's the face of this condition. How do doctors find it? Usually by looking at a blood smear under a microscope. If they see white blood cells with round or peanut-shaped nuclei instead of the usual multi-lobed ones, they might say, this looks like Pelger-Huet. It's like spotting a misshapen cookie in a batch. Doesn't change the taste, but easy to notice. To confirm, they might do genetic testing to check the LBR gene. Now, here's good news. No treatment is needed for most people. Since you're healthy, no meds or lifestyle changes are required. But, and this is important, doctors must know about it. Why? Because the cells look similar to those seen during severe infections or leukemia. So, if you get sick later, your doctor won't mistake your normal weird cells for a dangerous sign. Think of it like having a birthmark, harmless, but good to document. Since Pelger-Huet anomaly is genetic, you can't exactly prevent it like you prevent a cold with hand washing. But you can prevent confusion and misdiagnosis. How? By knowing your family health story. Ask, does anyone in your family have strange blood test results? If yes, maybe suggest they get a blood smear checked. If you're diagnosed, tell your doctors, put it in your medical record. Think of it like leaving a note, my white blood cells look odd, it's normal for me. That prevents unnecessary panic or tests in the future. And if you're planning, a family genetic counseling can help you understand the chances of passing it on. So prevention here means preventing medical confusion. Super valuable. Now for the science fans, recent studies are digging deeper into the LBR gene and how its mutation affects more than just white blood cells. Researchers recently found clues that the same gene might influence bone development and even nerve function. Imagine discovering that a typo in one gene can affect your bones, blood, and brain all linked. Also, labs are using AI to detect Pelger-Huet cells in blood smears faster and more accurately. Picture software scanning a blood slide, and saying, hey, these nuclei look like Pelger-Huet, check the gene. This helps avoid misdiagnosis. So while it's rare, science is making this invisible condition more visible and better understood every day.